good afternoon, good evening, Chicago. Welcome to another fall edition of Social Security Hotline 21. My name is Rocio Roman Oquendo. I am a claims specialist at the Social Security office located at 2127 West Lawrence here in Chicago. And here I will be today your host. And today with me is my guest, Andy Salata.
Hello.
I'm sorry. And the phone technician for today's show is Anthony Frazier. Hi, Andy. Please introduce yourself.
Thank you. Thank you for having me. Andy Salata. I'm the Public Affairs Specialist for the Social Security Administration for the Chicagoland area. So I get to coordinate our outreach so that way we get to talk with you in the community, and it's always a pleasure to be on CAN TV so we can talk with you live.
Mm-hmm. And we want to remind you, our viewers, that you are watching a live interactive call-in program brought to you on CAN TV 21 to discuss Social Security matters. We invite you to call in with your questions. The phone number in the studio is 312-738-1060. Again, the number to call is 312-738-1060. The phone number will remain at the bottom of the screen, and our phone lines are open now. Okay, Andy, so let's start with our topic today. Our topic for today's show is the Social Security cards.
Okay.
Most of the our public may notice that we stopped issuing printout of Social Security cards a couple of years ago.
Yes.
And I don't know if you want to give us a little more information about that, the reason, and what to do if the person needs a new Social Security card.
Okay, well, one of the main reasons when many of you may be familiar with when you went to our Social Security office to request a replacement Social Security card, you'd always ask for a printout or a verification of your number. And on there you used to have your name, date of birth, even parents' names, or Social Security number. So you used to have a lot of information, and then we used to cut it down to just your name and Social Security number. But if you really think about it, that provided another opportunity for your identity to be lost or stolen with your name and Social Security number on a sheet of paper. So to be ever vigilant and keep your Social Security card safe and secure, we stopped doing the printout. And what you can do to be safe with your Social Security number is to not carry your card around with you, because remember, really your Social Security number is your card. So as long as you know your Social Security number, then in most cases you can just provide that and it's verified, especially with most agencies now do verification electronically of your number. For example, the driver's facilities, when you do your driver's license, they verify the Social Security number you give with our records anyway. So a lot of times your Social Security number, as long as they don't need the physical card because of some rule or regulation, your number will be sufficient.
Mm-hmm. And one of the questions that most of our publics are always asking is if with these new changes in technology, if a person can apply for Social Security replacement cards online.
That would always make it so much easier, because some of our offices have more than 25% of our visitors coming in just for replacement Social Security cards. We are working on it, actually. There's about 14 states right now that have replacement cards online. What we are doing is we're working with each state to have a match with the Secretary of State's office or the driver's facility, so that way when you use your driver's license, you can replace your Social Security card. There's two requirements though. You need to have a My Social Security account created, and that way you have access to your Social Security information anytime you want. But unfortunately here in Illinois, we still don't have that agreement with the state of Illinois. If you live in Wisconsin or Michigan, you're luckier. But hopefully one of these times you'll hear from us first once Illinois comes on board.
Okay, that's very good. Not only for our claimants that needs to wait sometimes for hour or more in our local offices, but also for us as the employees of Social Security, that we can use the time to assist in a different way to our claimants in a daily basis. And what if, is there something particular that a parent needs to do in order to get a social security number for the newborn babies?
For newborn babies, it's pretty easy, and most times what we have is the hospital will file the Social Security card request for you. So once your newborn is born, they'll do the paperwork at the hospital, and it usually takes several weeks for it to come through, but the process is getting quicker. Now when it gets close to tax time or the end of the year, the hospital will let you know if there's enough time for them to do it or you need to. If you were to have to file for the card in the office, one of the important things is you'll need a birth certificate. So sometimes that birth certificate takes a while to be issued by the county. So you have to wait for that, and then you'll also need to have something else with the child's name on it, and that's usually shot records or health insurance, depending on how old your child is.
Mm-hmm.
Or if you have the insurance card, you can do it that way.
Okay, and it seems like we have a caller. Good afternoon, caller.
Okay, it seems like we have a caller. Good afternoon, caller.
A caller, please turn down your TV so that way you'll be able to hear us.
Hello?
I think we may have lost our caller.
Yeah. Just a reminder, when you are calling us, please lower the volume so we can hear a little clear the questions. So changing a little bit our subjects right now, you mentioned that a person needs to create a My Social Security account in the future in order to be able to apply for a replacement card online.
Yes.
So how difficult is to do that, to create an account online?
Well, to create an account online, one of the first places you need to go is socialsecurity.gov, GOV for government. And we can show you our website on the screen. When you do visit Social Security's website, you'll see our homepage. And if you just scroll a little bit down, you'll be able to see My Social Security. And My Social Security, if you click on that, you'll start going through the process. We will ask you some questions to identify who you are, so that way we can make sure you know, so we know you're you. So there'll be some questions from your credit report. Once you create your account, or once you verify that you know enough about yourself, you get to create your account with the username and password. It usually takes about 5 to 10 minutes. I've seen more people take longer to try and come up with their password or their password reset questions than they actually have to do it with their identity questions. So it's something that you can always do at home, and then that way you have access to your Social Security information anywhere you want, anytime you want.
Mm-hmm. It seems we have another caller. Good afternoon, caller. How can we help you?
Hello, good afternoon.
Hello.
I have a question in regards to early retirement. I will be 62 at the end of December. I'm planning to go online and start that process. I just wanted to know that once it's approved, when would I start receiving benefits?
Well, all depends on when do you want to start. In the application, you select the month of entitlement. So if you are turning 62, depending when, what day in December you're turning 62, more likely, unless you are born the 1st or the 2nd of December, more likely the earliest possible that you can start receiving your retirement benefit will be until January 17, because one of our rules is that the person must be 62 years old throughout the month. So January will be your first month of entitlement, and if that's the case, Social Security pays the benefit the following month. So if your month of entitlement is January 2017, the first check you're going to be receiving will be approximately in February. And well, there are a little other details, like if there's work involved and the amount, but generally that's the rule. The earliest possible is at 62, but you need to be 62 the whole month.
Yeah, so a lot of times people think, because a lot of times we get the question of how early can I file? And we can file as much as 3 months before. So a lot of people think it takes us 3 months to process the application, but really it only takes us a few days. and you're done. So if the only thing you always have to remember is we can only pay you from as early as the month you filed. So if you wait too long, you might miss some checks. But as long as you filing now for returning 62 in December, chances are, depending on when your birthday actually is, you'll get a check in January, and then it'll depend on which Wednesday for
Yes.
January for February.
Yes, exactly. And this is very important. Also in the website, once the person create their account, they can estimate benefit, like changing the month of entitlement, if they want to start benefits at 62 or 63, 66, even if they want to wait a little longer, and which, by the way, is considered a delayed retirement. Our website will be able to provide that information so the person can make a better decision, considering that retirement is something very, very important.
And you only may get to do it once.
Yes, exactly.
So yeah, for your situation, for a caller situation, the earliest you can file is age 62. But that means the earliest you go, the less you may get, because it's going to be reduced for early, it's permanently reduced for early retirement.
Exactly. And so let's go back to the website, so the person may get a little more familiar with our friendly website. It's very easy. You can apply for retirement or apply for disability benefit. Information about how to get a replacement Medicare card, or request the replacement Medicare card. Do something as simple as change of address or change of direct deposit. There's also the most updated information about the cost of living adjustment for 2017. And a lot more information here. You can see the retirement estimators, the most frequent asked questions about our online services. So it's very, very friendly, and there is no pressure when the person is navigating online. So as you can see, it's very easy. Just go online, into our website and start navigating, and you will find a lot of valuable information.
Especially as if we're planning on retiring toward the end of the year. Right now we're still getting good November weather, but sooner or later that weather's going to get cold and snowy. And if you do it at home, you don't have to worry about taking that hazardous road trip on Chicago streets.
Now, how about if we change again our subject and we go for something also important as it is Medicare?
All right.
What can you tell me about Medicare? Sometimes people get a little confused between Medicare, Medicaid, and the 4 parts of Medicare.
Yeah, Medicare and Medicaid, they sound so much alike, but yet they're 2 different programs. Medicare is the program that's based on when you turn 65 for retirement, and it's the Medicare credits or taxes you paid while you were at work. So you pay the Social Security taxes for your Social Security benefit, and then those Medicare taxes for Medicare. You can get it earlier than 65 if you were to receive Social Security disability benefits. If you're on disability and you have ALS, Lou Gehrig's disease, then you can get it earlier than our 24-month waiting period. Or even if you have kidney disease, transplant, or dialysis, that may provide with earlier Medicare. But to take a look at the Medicare itself, Medicare has 4 parts. There's Part A and Part B, and that's what's you enroll with Social Security. So when you file for your Social Security benefits, you're automatically enrolling in Medicare for that age. So for our gentleman caller that called earlier, and he was filing for Social Security benefits at 62, when he turns 65, Medicare will automatically come in. So you don't need to revisit us. We'll take care of you once, and hopefully everything runs smoothly from there. So the Part A is your hospitalization, so it covers your inpatient stay. Part B is your doctor and outpatient, And there's also some co-pays and deductibles that you have to pay for Medicare. And that's where some of the other parts come in. Part D is like the newest part to Medicare, and that's the prescription drug plan coverage. And that's done through whatever private plan you are selecting or you want to select. And then when you go through that, there's also a fourth part that you kind of hear about, Medicare's Part C. It's called Medicare Advantage plans, and what they do is they provide the traditional Medicare coverage of A and B, and they also give you prescription drug plan coverage, so they may also lower your out-of-pocket expenses. But you don't need to do Medicare Part C for Advantage. You can also take the traditional parts of Medicare, take a Medicare supplement, but then you need a Part D plan as well. What is very important for our listeners today is because we're in our open enrollment for the Medicare plans. From October 15th through December 7th, our Medicare beneficiaries can review their supplemental plans or their Advantage plans, prescription drug plans, and see if they want to change them.
Yeah.
One best place to do is if you go to Medicare.gov. On Medicare.gov, they have the drug plan and prescription drug, doctor and prescription drug plan finder. You can look at some of the choices to see if there might be a better plan. I always tell, I always at this time look to see if there's anything I need to change for my mom. So what you can do is, we all have someone that we know that's receiving Social Security benefits and are probably on Medicare, and this is a good time to help them navigate through Medicare.gov to see if they need to change any plans.
Yeah, thank you so much. And also there are a program called Extra Help with the prescription plan. In some cases, the person must reapply every year. That has some connection also with the Medicaid, and is like a subsidy. It's like a subsidy to lower the premiums for Part C of Part D, which is the prescription plan, and also at the time to buy the medicines, any copayment may be lower or even avoid. And for more information about Extra Help, the person can go to the local offices. They can apply at the office for Extra Help, and also they can apply by mail, and they can go online, I believe, also for Extra Help with prescription plan. Now, a reminder, Part D, Social Security Administration, we cannot take applications for Part D if someone are no very used to the internet. For Part D, the person will have to call Medicare directly, which the number is 1-800-MEDICARE. And we always recommend to have the name of the prescription that they are currently taking, to have them available, because they will select the plan based on the medications that they are taking.
Yeah, and another resource that our seniors can have is going to our senior centers here in Chicago. Our senior centers, when you visit the senior center, you can always ask them when they're going to have a SHIP representative. It's not from the Navy. SHIP representatives are our senior health insurance program from the state of Illinois. The SHIP personnel are they're trained by Medicare, so they know they can navigate through the plans and help individuals make a choice. So even though you may not be familiar with online filing, the SHIP personnel can help you look at the plans, and it can also help file for Extra Help online.
Yeah, it's very important to be informed, to get the assistance you may need with all your Medicare issues. And not only Medicare, it is important to know and to understand our process, retirement, disability. If it's not for us, maybe for a family member, for a close friend. And yeah, there are plenty of resources. And just go online in most cases, and the world is open and on the internet, and you can get valuable information. So
I guess what we can do is, if we go back to the website on the screen, what we can do is, if we scroll down to what you can do online, This will kind of reinforce what we were letting our viewers know about. If we click on the online services, that will show a list of things that we can do. Of course, we always like to hear from you, so if you ever get a survey, it's very important. But here it shows what you can request, and in there is the extra help part, as well as taking a look at what you can do for supplemental security income. So find out if you qualify for benefits is one of the best places to go. If you get Social Security benefits or have Medicare, you can. That's where this extra help is. What I like to let everyone know about is, since we have all those services online, one of the best things to remember is they have better hours. Because you may visit our Social Security offices and they're generally open from 9 to 4, except on Wednesdays. Like today, we're only open till noon. So that makes it a little harder to get to us. But if you can file online, that's generally a very easy way to get some of the information. So now, then that's our hours. So from 5 a.m. to 1 a.m. Eastern Time.
Yes, another issue is in this website, the person can print their own benefit verification letters that at this time of the year is very is one of the requirements for if the person wants to apply for assistance paying for the utility bills with the gas and light. Also, in some instances, if the person are applying for the bus card, they are requesting the income verification for the previous year. So that means for 2015, you can get it online. If you need to verify your income for any other service, for a loan, for a credit card, for student loans, you can go online. And even in cases when the person is not receiving benefit and they need that, a letter stating that has no claims pending with Social Security, you can go online. Please go online, because especially, and I am speaking for Social Security office, the one located in Lawrence Avenue, it's the waiting times are incredible.
We try and do what we can, but keep in mind, since Social Security touches everyone's life at some point, whether it's getting a replacement Social Security card so we can track your earnings at work, changing your name after marriage, or even for those, what we're all looking for is that time when we can retire and pursue our new career at our leisurely pace. Social Security is there for those things. So that means we get a lot of visitors. The offices in the Chicagoland area, we average over 1,000 visitors a week at most of our offices. Mm-hmm. So that means, and that doesn't even include our individuals who are calling our offices or the information that comes in the mail or internet. So that's why we always try and make sure there's a convenient way for you to reach us, whether it's traditionally visiting us in the office, calling our 800 number at 1-800-772-1213, or visiting us at socialsecurity.gov. Whichever way works best for you will allow you to get to us as quickly as possible, so that way you can still get the needed services as quickly as possible.
Mm-hmm. Well, Andy, it looks like we are running out of time now. What that means is that we are not able to take any more calls on this edition of Social Security Hotline. However, as you mentioned before, our 800 number is still available, so if you need any question, you can also call us. So on behalf of our hotline team, Rocio Roman Oquendo, your host, my guest Anthony, and our phone technician Anthony, I want to thank you for joining us today, and please join us next week also in a new episode of Social Security in Hotline 21.
And just to recap, remember, keep your Social Security card safe by leaving it at home, because you normally don't have to show it. So as long as you know your number, you'll always have your card with you. Mm-hmm. Take care.
Thank you, and have a good evening.